Hi guys, hope you're all well. This is Ulas. Today we'll study the shoulder joint. Okay guys, let's start. Guys, what is shoulder joint? Shoulder joint is a ball and socket type of synovial joint. Ball and socket type means there is a cup and there's a ball. We call the cup as socket and there's a ball and the it is moving like this. The joint is operating in various ways like this. So it is one of the highly mobile type of synovial joint among the synovial joint. So this is the ball and socket type of synovial joint. You can see here now, guys. See, this is the head of humerus. This is the humerus, and this is the head of humerus here. This is forming the ball, and the socket is formed by the socket. I'm drawing it in brown. It is formed by the glenoid cavity of the scapula. Okay, see here. These were the articular surfaces. Articular surfaces means the parts of the bone which are in contact to make the joint. Okay, so the glenoid cavity of the scapula and the head of humerus are the two articulating surfaces. And there's something interesting happening here. Around less than 40% of the head of humerus lies within the glenoid cavity. Means it is just in this image you might be able to see. It is, see, the glenoid cavity is just this much, and the head is this much. So it is less than 40 or less than 30% of the glenoid cavity is covering the head of humerus. Then how does the joint stay stable? See, it's a bone, it can move easily, and if it's holding only on this part, that won't be so stable now. So there are additional structures here which are providing stability to the joint. Which are they? We'll see now. Coracoacromial arch. See here guys, this is the coracoid process, and this is the acromion process. So between them there is an arch here. Arch means what? A like it's basically a like a ligamentous attachment. So it is covering like this. So it is giving an additional room for the joint to function. So we also call this coracoacromial arch as the second socket of shoulder joint. And then there is the musculotendinous cuff. Musculotendinous cuff is formed by the four muscles: supraspinatus, infraspinatus, teres minor, and the subscapularis muscle. We'll study those muscles in detail. See, these muscles will form it is even going behind. So these muscles will form a tendinous cuff around the shoulder that also gives stability. Muscles contract now, they have a tone. So if they have a tone, they can obviously take some amount of shock, and even at the resting state they can give a lot of stability to the joint. And then there is a glenoidal labrum, that is a fibrocartilaginous structure which is around the shoulder joint, around the glenoid cavity basically. Labrum means lips, labia is called lip, labia are basically lips. So it is like this, it is around the glenoid cavity. So this was the structures which are providing additional support to the shoulder joint. Other than that, there is something which is the triceps and the biceps muscle. The long head is taking origin from the supraglenoid tubercle, and the short head is taking the long head of triceps is taking origin from the infraglenoid tubercle. So the muscles are pulling it down now, so they are keeping the shoulder joint stable. That is also important in maintaining the stability, especially in the cricketers and all tennis players where there is a high impact and so much shoulder mobility. A significant amount of stability is even given by these muscles here. Okay, those were the ligaments. Those were the articulating surfaces. Now let's go to the ligaments. What are the ligaments, guys? Ligaments are the strong fibrous, strong band of collagen fibers basically, which attach bone to bone. Usually attach bone to bone. See, you can remember this mnemonic if you want. I had made it. That is, Coca-Cola is transported to girls' hostel. If you want to transport Coca-Cola in a crate, you have to carry it on your shoulder and go na. So if you are carrying it on your shoulder, the ligaments of the shoulder have to have the function of stabilizing the shoulder. So you can remember this. That's basically a trick I used to do. The first, see, there are the ones I have mentioned in green are the mnemonics for four ligaments. This CA is for capsular ligament, and the CO is for coracohumeral ligament. Coracohumeral ligament. Trans is for transverse humeral ligament, and GL is for glenoid labrum. Okay, those were the ligaments. Now let's go to the first ligament, that is the capsular ligament. The capsular ligament of the synovial joint. Guys, in any kind of synovial joint, wherever in the body, you can write the ligaments as the capsular ligament. It is common because definition of the synovial joint is it is within a cavity. The cavity is usually formed by the joint capsule, inside which there will be layering of the synovial membrane, synovial fluid and all. You can refer to the video on joints which I made, that can help you a lot in understanding the concept of synovial joint. Okay, guys, the capsular ligament, it is covering the shoulder now. So what are its attachments of capsular ligament are medially it is attached to the scapula, the supraglenoid tubercle and the labrum. The laterally it is going to the anatomical neck of the humerus, and inferiorly till the surgical neck, and superiorly there is one insufficiency for the passage of long head of biceps. See here, I'll just show you guys. See here, the capsule is attached somehow like this, coming till here, coming here, going till the surgical neck, and again means it's like 360 degree around the shoulder. So it's basically like this, the capsule of the shoulder joint, and there is the long head of biceps coming from the supraglenoid tubercle like this. Now it is going inside and coming outside here. So that is the insufficiency for the long head of triceps. In this region there would be a small insufficiency. Now the second important ligament is the coracohumeral ligament. Where is it going? From coracoid process to the humerus. Here, this is the coracoid process to the humerus. The coracohumeral ligament is going. Okay, like this. And the where exactly coracohumeral ligament is going from the root of coracoid process to the neck of humerus. Like this. This is the root of coracoid process to the neck of humerus. Root to the neck. Root to the neck. That is the coracohumeral ligament. Coracoid process to the humerus. Then there is a transverse humeral ligament. Transverse humeral ligament. What is it? Guys, see here. This is the greater tubercle of humerus. This is the lesser tubercle of humerus. And this is the transverse humeral ligament. See, there is the long head of biceps coming like this from the supraglenoid tubercle. It is coming like this. It will go under the transverse humeral ligament. Transverse humeral ligament. It will go under the transverse humeral ligament. That is also ligament of the shoulder joint. And then there is a glenoid labrum which we just discussed. See guys, this is the glenoid cavity now here. Glenoid cavity of the scapula now. So there is a transverse, the glenoid labrum here surrounding the shoulder joint. So that is providing an additional cupping. Like if this was the socket like this, it is providing an additional cupping like this. So a larger diameter, better stability of the shoulder joint. That is how the glenoid labrum works basically. And it is a fibrocartilaginous structure now, so it can take some amount of shock and it has some elasticity. Like it can, just like I'm holding rubber bands like this, and it is this is the head of humerus. I'm holding rubber bands like this. Then it goes like this, attach. So it is giving additional stability to the joint. Those were the ligaments of the joint. Now let's go to the bursae. What is bursa? Bursa is a pouch of synovial fluid. Basically, the outer layer will be the synovial membrane. Inside that will be synovial fluid. That is basically forming the shock absorption functions. So there is subdeltoid bursa under the deltoid muscle, and like basically under the deltoid muscle. Then there is subscapularis bursa between the chest wall and the subscapularis muscle, and there is the infraspinatus bursa which is under the infraspinatus muscle. So those were the three bursa, and the subdeltoid bursa is also called subacromial bursa. These are the main bursa. Other than this, there are subcoracoid bursa, supraspinatus bursa, which are accessory. Means these three are mainly involved in the function. Blood supply. This is interesting, guys. Just remember this mnemonic APSS. APSS का मतलब क्या? The A is the anterior circumflex humeral. Anterior circumflex humeral vessels, and posterior P is the posterior circumflex humeral vessels. S is the suprascapular vessels. and S is the subscapular vessels. We just studied that now. See here, the anterior circumflex humeral and posterior circumflex humeral vessels are somehow like this. See, the anterior circumflex humeral and the posterior circumflex humeral. So they are giving branches to the shoulder joint. And then there is the subscapular and the suprascapular artery. Suprascapular artery goes, subscapular artery comes like this, suprascapular artery goes behind the scapula. So those both are supplying the shoulder joint too. Those were the artery supplying. Then there is the nerve supply. Nerve supply of the shoulder joint is by multiple nerves. Which are they? They are the axillary nerve, musculocutaneous nerve, and suprascapular nerve. Those three are giving branches to the shoulder joint. So there can be also referred pain regarding those three nerves. We'll study that in detail. I'll make a video on that. Then there is the movements of the shoulder joint. Movements of the shoulder joint, what are they? Flexion, extension, abduction, adduction, medial rotation, lateral rotation, circumduction. It is one of the highly mobile joints of the body. Guys, there is a concept of mobility and stability. If the joint is more mobile, it is less stable. The reason why the shoulder joint is more mobile is because the socket holds only 30% of the ball. So it has a lot of room for movement. It can move all the ways. And the same reason that the socket is holding less of the ball now. So there can also be a possibility of dislocation, subluxations. So shoulder joint is frequently dislocated as compared to all other joints. Hip joint is one of the most stable joint, but it has limited mobility. Okay. See, what are the movements of the shoulder joint? Flexion, extension, abduction, adduction, medial rotation, lateral rotation, circumduction. Okay. What are the muscles causing it? Flexion. Flexion, if it is moving like this, obviously the anterior compartment muscles now, which are the pectoralis major, clavicular head of pectoralis major mainly, and there is the deltoid, anterior fibers of deltoid. They are causing flexion. Then there is an extension of elbow. So the muscles in the back, which is the sheet-like muscle in the back, that is the latissimus dorsi, and the posterior fibers of deltoid. They are causing the extension. Then the abduction. Abduction 0 to 15 degrees supraspinatus, 0 to 15 degrees, 15 to 90 deltoid, above 90 serratus anterior and trapezius muscle. It's one of the very interesting concepts, the abduction of shoulder joint. We'll discuss that in detail too. Then the adduction is formed by this is abduction. Adduction, again, the muscles from the front, back, both pull. See, pectoralis major is pulling, latissimus dorsi is pulling, and then there is a long and short head of biceps. See, this is the biceps now. As I'm pulling it down, the biceps is also getting tensed. It also has an action there. And the medial rotations. Medial rotators, see, if pectoralis major contracts, will it cause medial rotation? Yes, it will cause. Then anterior deltoid. Usually the flexors will be medial rotators. And then there is a latissimus dorsi. It is also, why? Because latissimus dorsi is coming like this and getting attached to the front. So if it contracts, it will contract like this. So it will cause medial rotation. Then there is a teres major. Teres major is also coming from here going to the front. So it is coming from the scapula and going to the front now. So it is causing medial rotation. Then lateral rotators, obviously the extensors, posterior deltoid, extensors, not the latissimus dorsi, because latissimus dorsi is attaching in the front. So it is causing medial rotation. Lateral rotation by posterior deltoid, the infraspinatus muscle and the teres minor muscle. Major is causing medial rotation. Minor is causing lateral rotation. It is the direction of the fibers basically. Then there is circumduction. All the muscles are working for this function, the circumduction. Guys, now let's go to the clinical importance. I have a code for you here. The capsule of the shoulder joint is weak inferiorly. So if the shoulder joint gets dislocated, it can be easily dislocated at the inferior level. So like if the joint is here and inferior is weak, the joint, the head of humerus can come down like this. Now, if it comes down like this, there is one important nerve in the surgical neck of the humerus. Which is that nerve? Can you tell me? This is the code word. This I have jumbled it. This is the name of a nerve. Can you solve this for me? Which is the nerve injured when there is inferior dislocation of humerus? Okay, inferior dislocation of shoulder, basically a nerve is around the surgical neck of humerus. You can pause it and say if you would like. I'll tell you now. The nerve is the axillary nerve. Axillary nerve is winding around the surgical neck of humerus. So if there is inferior dislocation of the shoulder joint, there can be damage to the axillary nerve, which leads to the paralysis of the deltoid, and if not treated in the right time, it can also cause flat shoulder, okay, and difficulty in abduction of shoulder. And there are other concepts regarding, like what if the bursa gets inflamed. If the bursa gets inflamed, it can cause bursitis, and if there is excessive accumulation of fluid, we'll have to put a syringe and drain. Okay guys, this was a class on shoulder joint. If you have any doubts, please post it in the comment section. I'd be happy to answer you. Okay guys, take care, bye.